The U.S. Surgeon General this week announced that he will push Congress to put warning labels on social media platforms, similar to the warnings on cigarettes and alcohol. He wants the labels to advise parents that using social media might damage the mental health of adolescents. For more on this, we welcome Swapna Reddy from the ASU College of Health Solutions. Always a pleasure, Swapna. Good to see you.
Thanks for having me.
All right, what is this? What exactly is a Surgeon General saying? I mean, how do you put a warning label on a social media app?
Yeah, I think it's a little bit more of the message and the platform and the agenda setting that the Surgeon General is establishing by basically saying, look, we have a mental health crisis in this country, and this is consistent with what he's been talking about for the last few years. He had a very strong platform on loneliness as a public health issue during the pandemic, and really the focus now is there is a mental health crisis among our adolescents, and social media is something that we really need to take a deeper look at and really try to figure out how we can make that a safer platform for our teenagers.
Now, warning labels, he says, worked for tobacco and they worked in some degree for alcohol. Can it work, though, when you're dealing with kids and parents and that whole dynamic?
So I think the actual warning label piece, who knows how effective the actual warning label is, right? I mean, and we have to remember that the Surgeon General's kind of warning, it's not enforceable. It's more of sort of a policy setting, agenda setting mechanism. And I think that that's actually kind of what's more important here. And actually, I applaud the Surgeon General for really focusing on mental health and adolescence and really establishing that mental health is a really important public health issue, and it's something that we need to treat like all health issues.
I was going to ask you about that. This study shows that kids that are on apps 3 hours a day, if they're on these social media apps, doubles the risk of anxiety. And another study says they're on these things for 5 hours a day.
Yeah, absolutely. So here's what we know. We know about 95% of adolescents are on some kind of social media, right? So that's almost all of them. And we have over half, the study that you're talking about that I think is cited more often, over half of adolescents are on these apps for almost 5 hours every single day. So if we had any product, period, that 95% of our kids were on and over half were on almost 5 hours a day, we'd want to make sure that that product is safe. We'd want to make sure that we have research and data on the safety. We probably have some regulation, and we definitely kind of want to have more guidance about parents and teachers and how to better deal with it.
And a big part of this is that these are kids. The developing brains don't need this kind of thing.
Well, and what we've seen is we don't have a lot of conclusive research yet. We haven't had a large body of research on the effects of social media on these developing brains, but we do have some conclusive research for some specific subgroups. So especially girls, we see that girls, about 50% of girls on social media are saying that they have a worse body image as a result of being on these apps. We have some recent studies that have shown just reducing social media by about 50% for these girls for a couple of weeks makes a huge difference. Anxiety and depression, about twice the rate for girls as it is for boys. Same with our LGBTQ youths, really seeing about 40-something% depression and anxiety. So what they're actually being exposed to, how often they're being exposed, ends up being really important.
Yeah, I mentioned developing brains don't need this kind of thing. Does any brain need this kind of thing? I mean, this is a real addiction.
Yeah, and you know what? About 30% of all adolescents are saying, I'm addicted to social media. I'm having a hard time controlling myself on social media. And it's, one thing that we have to be aware of is it's not just the time that's being spent, although it is the time that's being spent, it's also what they're being exposed to, especially young people that are being exposed to very violent imagery, hypersexual imagery, and also some of these sort of very disordered eating and body image kind of imagery we're seeing are having sort of the worst outcomes. So it really begs to the issue is really about we need to have more research, we need to have more data, and we need to think about how we can make this a safer product because we have to be realistic. Kids are using it, right? And also think about what type of legislation do we need? What does that need to look like? And what do parents need to be aware of?
Yeah, the parental guidance has to come in there somewhere. The Surgeon General recommends using texts as an intermediate step, phone-free zones at bedtime, meals, and social gatherings, and also phone-free zones at schools, which seems to be bubbling up around the country.
100%. So all all of those other recommendations, I think, have been around for a few years in terms of, don't have phones always available to teens, have a time when you're just on a phone-free area, have time limits for these apps, try to have family time when no one has a phone out, including mom and dad. I know that's hard to do. I'm the parent of 2 teens. I get it. But also really interestingly, kind of this movement around phone-free schools. And just actually this week, Governor Newsom in California is introducing a proposal to regulate the usage of phones in all of the schools in California. And what we've seen with a few of the school districts around the country who have done that, we've seen some really good evidence. Less bullying, less depression, less anxiety. Very importantly, more ability to concentrate at school. It's a distraction to have your phone out.
Yeah. So I guess bottom line, yay or nay? We got about 15, 20 seconds left here. Good idea, or is this basically a conversation starter?
This is a critical conversation starter. We're at a critical point on this issue. So again, establishing that mental health for teens is an important issue, public health issue. Social media is contributing to this. We need to have more research. We probably need to have some legislation, and we definitely need parents and educators involved in the conversation.
All right, very good. Swapna Reddy, ASU College of Health Solutions. Great job. Always a pleasure to see you.
Thanks for having me.